Today, I'm going to talk about the specific content of the theoretical basis related to this topic. I will talk about the attachment theory, self-identity theory, trauma theory, and the combination of art therapy and these theories. Attachment theory is a psychological theory developed by John Bowlby, Mary Ainsworth, and others that focuses on the impact of attachment relationships formed in early life on individuals' development and behavior. The first is the formation of attachment. Early attachment theory states that individuals form attachments in early lives through interaction and communication with a primary caregiver, usually a parent or caregiver. This attachment is one of the most important relationships in an individual's life and has a long-term impact on an individual's physical and mental health. The manifestation of attachment behavior includes seeking protection, seeking comfort, exploring and controlling emotions, and etc. These behaviors help individuals establish a sense of security and trust. Then is the attachment type. Individuals who are securely attached usually exhibit trust and dependence on their parents or caregivers, are able to actively explore their environment and seek comfort and support when needed. Insecure attachment includes anxious attachment and avoidant attachment. Anxious attachment individuals often show excessive dependence and anxiety, fear of abandonment. Individuals with avoidant attachment tend to avoid attachment relationships, showing apathy and independence. Individuals may exhibit different types of attachment behaviors in different situations, forming mixed attachment. And then let's talk about the attachment model. Attachment theory holds that individuals form an internal working model through early attachment relationships, which is a psychological representation of perceptions and expectations about attachment relationships. Internal working models influence individuals' acceptation, attitudes, and behaviors toward others, with lasting effect on later attachment and interpersonal relationships. The effect of attachment relationships can be divided into the following points. It helps individuals establish a good emotional connection and trust foundation, and promotes emotional development and healthy growth. It also helps individuals to build positive self-perception and social skills and promotes behavioral development and self-regulation. And also, it helps the individuals to form a positive internal working model and promotes cognitive development and the improvement of thinking ability. Finally, coping and recovery. When individuals face attachment frustration or attachment relationships breakdown, they can restore attachment security and psychological balance through attachment repair process. Attachment theory provides an individual theoretical basis for psychotherapy, and therapists can help individuals explore and understand their attachment patterns by establishing a safe therapeutic relationship so as to promote the individual's growth and recovery. Self-identity theory is an important theory in psychology, which mainly studies how individuals construct and maintain their cognition, emotion, and evaluation of themselves. The cognition, emotion, and evaluation of the individuals constitute the self, which is the internal expression of the core identity and personality characteristics of the individual. Identity refers to the individual's self-cognition and evaluation, including their identity, characteristics, values, and other aspects of recognition and acceptance. Individuals form self-identity through comparison and reflection with others, and obtain their cognition and evaluation from the feedback of others. The social environment and social roles of an individual have an important impact on the construction of self-identity. Social identity is the role and status of an individual in the society, which affects the individual's cognition and evaluation of himself. Self-identity is gradually formed in the early development of individuals and is influenced by many factors such as family, schools, and society. Adolescence is an important stage in the development of self-identity, when individuals begin to explore their own identity and values and seek independence and autonomy. In adulthood, individuals gradually establish and consolidate their self-identity, forming stable cognition and evaluation of their identity and role. Individuals tend to maintain consistency in their self-identity and maintain their self-image by screaming, interpreting, and remembering information. Individuals may use various psychological defense mechanisms to protect their self-identity, such as denial, defense, rationalization, and so on. Good self-identity helps individuals build healthy self-esteem and well-being and promotes mental health and positive adaptation. A strong self-identity helps individuals cope with challenges and difficulties in life and enhance psychological resilience and resilience. Individuals can obtain social support through communication and interaction with others and enhance the stability and positivity of self-identity. Psychotherapy can help individuals explore and understand their self-identity, solve the identity crisis and confusion, and promote individuals' growth and development. The trauma theory refers to the theoretical studies of trauma and psychological trauma experienced by individuals, aiming to understand and explain the impact of the traumatic events on the mental health and development of individuals, as well as the adaptive process of individuals coping with trauma. Traumatic event refers to the events that causes serious threat or harm to the life and physical and mental health of individuals, such as accidents, natural disaster, violent events, wars, and etc. Individuals may experience a traumatic event directly, or they may be witnesses or indirect victim, both of which can have a traumatic impact on the individual. After traumatic events, individuals may have a series of stress reactions, such as fear, anxiety, anger, depression, and other emotional reactions, as well as sleep disorders, attention difficulties, and other physical reactions. Some individuals may experience the prolonged post-traumatic stress reaction that develop into post-traumatic stress disorder, which is the PTSD, and manifested itself in persistent traumatic memories, avoidance of stimuli, negative emotions and behaviors, attention and sleep problems, and more. The trauma adaptation model describes the process of individuals' adaptation to traumatic events, including impact stage, reaction stage, coping stage, and recovery stage. Some individuals experience growth and development after trauma, which manifests itself in a deeper understanding of life, a greater appreciation of relationships, and a reappraisal of self-worth. Psychotherapy is one of the main ways to treat post-traumatic stress disorder and traumatic response, including cognitive behavioral therapy, exposure therapy, eye movement desensitization, and reprocessing, which aims to help individuals understand and process traumatic experiences and restore mental health. Medication, such as the anti-anxiety medication, can be used in some cases to assist in the treatment of post-traumatic stress disorder. Traumatic events may serve as growth and development opportunities for individuals to develop greater psychological resilience and adaptability, and to value life, relationships, and intrinsic value more. Individuals who experiences the trauma may have a renewed sense of meaning and value in life, and through the positive coping strategies and psychological mechanism, confidence and hope for the future can be restored. Social support is essential for individuals to cope with traumatic events and to recover their mental health, including support from family, friends, and the community. The prevention of traumatic events is an important means to protect individuals' mental health, including strengthening society security, mental health education, and establishing mental health support systems. Combining art therapy with self-identity theory, attachment theory, and trauma theory can provide individuals with a comprehensive approach to psychotherapy that promotes recovery and growth from traumatic experiences and reestablishes positive self-identity and healthy attachment relationships. Individuals express and explore their own identity and self-identification through artistic creation and reflect their inner experiences and emotional needs through painting, writing, dancing, and other ways. An individual's self-identity and sense of identity are influenced by early attachment relationships and art therapy can help individuals understand their own identity and self-worth by exploring the relationships between the individuals and the primary attachment object. Art therapy provides a safe environment in which individuals can express and regulate their emotions through artistic creation, including the emotional interaction and connection with attachment objects. Traumatic events can have a negative impact on an individual's attachment relationships, and art therapy can help individuals explore and understand this impact and repair and rebuild healthy attachment relationships through the artistic creation. Art therapy also can help individuals express and regulate the emotional responses associated with the traumatic event, including fear, anger, anxiety, and other emotions, thereby reducing the psychological stress caused by the traumatic experiences. Through artistic creation, individuals explore and reconstruct the cognition and meaning of traumatic experience so as to find new hope and meaning and promote psychological recovery and growth. Thank you for watching. In the next chapter, I will talk about the specific art therapy techniques.